Welcome to the In Season podcast, rated R for language.
None of us are doctors or neurologists. The things you're about to hear are opinions of people living with epilepsy or seizures. These are firsthand experiences. Epilepsy can cause speech problems, and the medications are hard to pronounce. So please bear with me.
Epilepsy can cause bad memory, so some stories will be repeated. I'm Pookie. Get ready.
It says topiramate and weight loss. I'm currently taking 200 milligrams of topiramate per day, 400 milligrams of cinnamomide, 10 milligrams of clobazam, and my appetite has disappeared. Not a good thing, by the way. I've gone through most of my meds now at high doses in different combos, etc., as recommended and prescribed. Over the past years, doctors have also mentioned topiramate but warned of weight loss issues, so I have avoided it. I managed to wean off lacosamide because after a few years, the doses were getting very high and I could barely talk or walk in a straight line. Topiramate was one of the few left I haven't tried. My appetite and weight is declining. It's become real chore to eat. Most people say, wow, where can I get that? It sounds amazing, etc. But for me, I'm naturally skinny, so I have spent years exercising and eating correctly to build a bigger, heavier frame all over. I don't want to lose weight. I also have the VNS, so if I lose too much muscle in the chest area, that might even start poking through. Did anybody notice the side effects with topiramate? Even if you don't have topiramate, somebody got some advice for this person?
I am not on that, but and this is not advice for this is just what works for me. I would just like to clarify that what a little weed helps my appetite with my stimulant medication. And a lot of the times when I'm just not hungry, because being autistic, when I don't feel like eating, it makes me angry to eat, and that could go on for days. So if I get myself a little stoned, it helps, even if it's not a lot of food, it's something. It's better than refusing to eat because I just don't feel like eating. But it is and not in a like eating disorder way. It's just a sensory thing. And yeah, munchies are a blessing. Munchies do it. They help so much. They help my appetite incredibly, and they are a lifesaver for me a lot. Because I could go like a week without eating, and that's awful. Or drinking too, because I just like just something about eating or drinking just makes me angry and overloads my senses, and I'm like, no, I want no flavors, not even water. I want nothing. But if I use a little MJ, then I'm like, oh, okay, I'm hungry, I'm thirsty, my mouth is dry, and I'm hungry again. So it helps.
Yeah, like you were saying, the other person was saying, like, it kind of feels like a chore to eat. You gotta force feed yourself. Like, I can go days without eating because I'm not gonna say I had bad memory that I wouldn't remember to eat, and I didn't have the appetite, so I couldn't even remember if I ate or not. So I was going through days like that, and I was on a strictly water diet. I was not knowing if I was eating, but I know I was drinking because I was peeing, and for some reason, losing weight, and I would lose weight like crazy, and wouldn't be doing anything but sitting around drinking water, editing videos. But yeah, what worked for me to get back an appetite is B12 by Nature's Made. Helped out everything. Might sound like I'm crazy, but for some reason I'm eating on a regular now, and I don't eat on a regular before these. Get more energy, and I'm eating more. So I'm hoping I can gain some weight. I'll point that out in the further weeks to come. Shout out to Nature's Made.
I think depending too if that person's like female, weight fluctuation, it could be for anyone, but especially for females and their periods and stuff, like that can play a huge part into eating and your appetite, and things like that. So also being aware of that time, of properly having nutrients for your body to get through that time for any females, just as a off thing. I'm not great at nutrients, but since moving in with my grandpa, he likes to have his meals and stuff, so I've been eating a lot better, and I find that eating helps. Eating real food helps, sometimes, even if it's like just a bland, easy meal, like just make sure that you're kind of still getting the nutrients. Just because you're eating doesn't mean you're getting nutrients.
Good advice. Yeah, but like I said, eating lately has not been a problem. The B12 has been helping. Shout out to Nature's Made, and like I said, better appetite and more energy lately. And I'm gonna blame it on the B12 because it's been doing pretty good. And yeah, let's move on. Shout out to Nature's Made. It says periods. One for the ladies, if you don't mind.
Can I
Anyone else?
say something real quick?
Go ahead.
I want to show you something. This is my spark. If you could see it.
Hey, Spark.
He was the one that rescued me today.
So you're a brainstorm right now, and she's Spark.
Yes. And he just got food. Okay. I'm
You
going
ready
back
to
up.
answer that icebreaker?
Yeah. Bam. The dogs. The dogs by my side. They keep up with me, if that makes any sense.
It does.
Yes.
So
I'm kind of jealous of Lufa that she's actually on ADHD medication. My neurologist said no.
That here's my thing. My neurologist does not know.
Oh,
So
oh my
I
god.
do plan on telling him when
Yeah.
well, I did kind of tell him, but at that point when I told him I've already been on it, and he's like, okay, so I guess we're just gonna work with it then and switch to the React. But I just went to my psychiatrist and he said the best words ever. He was like, just because you have one condition doesn't mean that we can't treat another.
Oh, she was
So
okay
he
with
was like,
Strattera, but Strattera just doesn't work for me.
yeah, he put me on the Concerta. He started me at 18 milligrams, which is lower than the starting dose, I think. I think the starting dose is usually 36 milligrams. But because
Yeah, 18 and a half is the starting dose for like
yeah,
children.
I'm
It's like
kind of
the baby
afraid of
dose.
medicine, if that, well, not
well,
of seizure medicine, but I'm afraid of ADHD medicine,
I was too, but
particularly since my other thing that got me through is writing.
yeah, yeah.
I'm afraid that if I'm afraid it might cut my imagination because that's what I remember from high school is that it literally killed you as much as Topamax does.
So I've taken Adderall before, not prescribed, but from somebody else, and
I sold.
anyways, I didn't like it. because I found it just overstimulating and just like weird.
I found it killing.
Yeah, I didn't really like it, and it completely killed my appetite too. And I already have like my eating problems with my autism, so it my weight's constantly fluctuating, and that did not help. So when I talked to my psychiatrist about it, he was like, "Have you ever been put on?" Or I have been put on Adderall before, but for like a really short amount of time, for like a month, and they just took me off of it right away. I don't know.
I was on
That was weird.
Adderall since I was like 12. I was on
Yeah,
Ritalin before that.
they never they never tried to treat my ADHD.
Oh, my mom did. She tried her hardest because
My yeah,
it definitely affected me.
we tried our best, but they just refused to because they were so focused on the BPD and the bipolar.
Mm.
So it made it really difficult. But
Oh,
I
what did
don't like
mom just say?
I don't like antidepressants and I don't like antipsychotics. I've always had really bad problems with them. I've had the DNA testing and genetic testing to see what I work well with when it comes to medications. And when my doctor, my psychiatrist I have now, I love him. He was like, "Have you ever been properly treated for your ADHD?" And my mom and I were like, "No, like, what are you talking about?" Like, he was like puzzled. He was like, okay, so we're gonna try this, but because you have epilepsy, we're gonna start you at a lower dose that we would usually use for like children. And
Yeah.
um we can work you up to then the starting dose and probably just leave you at the starting dose because we don't want to overstimulate you. And if the starting dose for adults is too much for you, then we're gonna bring you back down to the 18. And I think just having a psychiatrist that is very aware of my epilepsy and the fact that if I don't have my ADHD treated, that is not going to help my epilepsy at all, and I'm going to be bedbound still because I need a stimulant to function. It's like I always use it as like a computer that's not plugged in. Like how are you supposed to how do you get a PC to work if you don't plug the PC in? If you have no outlet, you have nothing, what am I supposed to do? I'm just here then taking medication for my epilepsy, just sitting here depressed. So the ADHD medication has been a huge improvement in my life. Huge improvement. And I went into it knowing not asking permission from my neurologist because
Neurologist.
I was like, he's probably gonna say no. But I know what I need. I know my body. He's gonna say no from his medical standpoint, which I completely understand. But
Yeah.
I have, like my doctor, like my psychiatrist said, I have more than one condition, and that doesn't mean that one gets prioritized over the other because they ADHD and epilepsy both I would say equally affect me. And so they should equally be treated. Therefore,
And I understand. And I may bring it back up again because, well,
If I may ask a question about the ADHD, um, I might be seeing a psychiatrist soon about whatever. Um, is this? Uh, I'm very nervous. I don't want to take any more drugs, especially ADHD drugs. I mean, and I don't think I have ADHD naturally. It's all just
naturally.
no,
Sorry.
I don't. I know what kind of person I was before I started the epilepsy drugs. I was very focused, and the stuff I got done.
I was
I got
always
done.
hyper.
I got done more in 1 week than I got done in my entire adult life
Oh, don't get me
as a
wrong. I
kid.
have the can do attitude. If I can do it, I can do it right now because I'll forget later.
But yeah, now but so the point is, how well, yeah, this is the point. I can't focus for my life, and uh, uh, so it's worth it. I mean, you say these
I
ADHD drugs.
Yeah, for me it's been worth it. I don't take so he also I have really bad anxiety and unfortunately like you can't treat everything perfectly. Not everything is going to be Pookie, I'm jealous. Not everything is going to be treated the way that you want it to. So my anxiety is a constant battle. Like just I just know that there's nothing that is ever going to calm down my anxiety. I am Have you ever seen those little round people and they have little names like happy or sad or
Inside Out.
no, no.
No.
Those were funny, yeah,
Like
on the
Miss
yeah,
or
on the
Mr.
Prozac commercials.
Oh.
I don't there were these little cartoons and my it was like kind of to show like or there was like Mrs. Sassy and they all had like different fun characters to them.
Sounds like Inside Out.
Yeah, my son just
It
got
was
done with an
before that.
Inside Out
The
camp.
child. It was before Inside Out. It,
Oh, okay.
it was before Inside Out. I can literally find it. I can literally find it. But
I remember Inside Out, your first emotion is your core emotion that rules your life. And we always joked that mine was anxiety.
yes, there's like these little yeah. So if I was any um little I'll find them in a second and I'll show them to you guys. But
I'm
um
looking it up.
I
Nikki knows
I
them.
yeah, it was like Miss Sunny and Miss like Daisy or Miss Anxious or something. But I was always like anxious. So I've always been anxious. I have that's just something that nothing will ever treat. Like nothing's ever gonna make me not anxious. I'm just anxious. So it's just learning other ways to deal with that. But the ADHD med has been so helpful because before this, especially after receiving ECT, I I would just sit for hours, like, and do nothing. Like I don't there could be people around me on their phones, reading a book, watching TV, playing with the cats, and I am just sitting there. Like there's nothing going on in my head. I sometimes I'm thinking about, okay, if I do this, I can then do this, and then I can do this, and I can get this done. But I think of it all, and then I'm like, oh my God, that's exhausting. I'm exhausted. That just took so much energy to think about. How am I going to do that? I should just stay here because if I don't get up, then I won't be exhausted. And then when I do get up, I'm like, oh my God, this is awful. What am I gonna do? I don't know where to start. Where do I look? What do I do? There's this here, this is there. What do I like? I'm in shambles. So
Sensory overload.
yeah. And
That's kind of exactly how I feel right now. That's where I am at
so
mentally,
when I
my
started
brain.
taking and I've just recently started taking it, um, the Concerta, it's been a complete 180. Like my room is clean. Um, not to my mom's standards, but she has OCD, so that's different. But um, well, she doesn't have standards for my room, but I don't have any organizational skills, but that's just me as a person. Um, but I can like get myself up at 8 a.m. if I want. I'm really pushing it. But usually I'm ready by like 9:30 in the morning, and that's a huge improvement for me. I can make noodles. I made guacamole the other day, and my mom ate it all, which I was sad about. Um, because it tasted really good. So I understand why she ate it all. But it still takes a lot of energy out of me, but the difference is now is that I'm able to do it and kind of keep going on until I am kind of burnt out, because eventually I do get burnt out and eventually the drug wears off. So there is that moment in the day where it is completely out of your system and you could be in the middle of doing something and you're like, nope, I have no more left. I have nothing left. And that's okay, because you got at least like maybe 6 hours of things done today that you wouldn't have without the medication. So for me, it's been a huge improvement.
Yeah.
Because other things just don't work, like natural remedies, things like I've tried so many things to try and focus, and I just don't have that peace, and I've never had that peace in my brain. So the ADHD medication has been a life changer, and I will continue to take it like a good patient as prescribed, because he was like, this is a controlled substance. If you run out earlier, I'm not I'm not giving you any more. And I was like, you don't gotta worry. You don't have to worry. I don't want to take more because I'll have a seizure. And I'm not selling it because it's mine. And I'm not gonna do that. And I need it. Literally, I need it. So, yeah. Unfortunately, some things aren't fulfilled unless I do have medication, and that's just the reality of things. So, but it's better than sitting around for hours doing nothing. Like, I've been able to do the dishes. I've been able to do laundry. I've been able to brush my teeth morning and night. Which I was really surprised when I went to the dentist and he said I have immaculate teeth, because I had such bad, like, my ADHD was so bad that I wouldn't brush my teeth for weeks, and my hygiene was just down, and that's just like, it's just like the reality of it. And being neglected by other doctors made it really hard. And then having the epilepsy on top of it made me not want to do anything. It made me just want to rot in bed, and that's what I would do, was just rot. I was just rotting away. So, um, yeah, it's just with ADHD, if you don't have someone helping you, there's like, it's literally just like something's not plugged in, and you can literally, people think like ADHD is you running around in all different directions, but it's just in your head. In reality, in real life, you're sitting in one place, and next thing you know, it's 10 o'clock and you're going to bed, and then you're waking up and you're sitting down and you're staring at the wall again, and then it's 10 o'clock and you're going to bed, and it's the same thing every single day, and it's so depressing. It's so depressing.
There's a term called executive dysfunction, and it's very popular with uh, people with ADHD. I do the exact same thing. I don't know if I have ADHD, but I definitely have executive dysfunction, where it's basically there's a million things you have to do, and you're just like overwhelmed by it, and you're just like, nope, can't decide. It's kind of like when you're scrolling through Netflix and you're just like, there's a million options and you can't pick one. It's like
Yeah.
that, where you're just sort of like, no, no, no to everything because you just can't make a decision.
This is gonna sound weird. My ADHD makes it easier to bully me around because I am so hyper. It's like, okay, now you should do this. Now you should do that. Now you should do that. And then don't get me wrong, my parents do not bully me. It's just happened in the past. And it's all about tone and demanding versus asking. Like a few minutes ago, my dad came, he's like, hey, can you go feed the dogs? Of course I can. That's not
Yeah,
bullying me. That's a gentle reminder. Go feed the dogs.
that's a huge thing. Like, like there's some things that like my mom is really good with me because she knew I had autism since I was a kid, and it was just the doctors neglecting me, so it was her taking care of me. So she's been really good with like I don't eat with people. I don't like to eat with people. Um, I don't bond over eating. I don't bond over food. All I hear is chewing saliva. All I see is the food in your teeth. That's all I get from it, and it makes me angry, and then I don't enjoy my food. So my mom, it's just been me and my mom. So we usually when we eat, if we eat together, we're watching a show. So there's sound in the background, or I'm somewhere else, or if I'm with the family, then I eat somewhere by myself. And they try so hard to get me to join them, but I'm like, can you please like leave me alone? Like this is the last thing I want to do is join you guys for a meal. But it's just it's I forgot what the point was I was getting to. But
Nick, you just made a great point.
I just my mom is really happy that I can now like she is a like my family doesn't have kids with ADHD like I do or anything like I do. Um, and so they don't understand the importance of me washing the dishes and doing the laundry and feeding the cats. And when my mom is like, when she comes home and she sees the dishes cleaned, she's like, "Thank you, you did the dishes." Like, yes. And I'm like, I know. She's like, "We can tell your doctor. He's gonna be so proud of you." She's like, "We're making such good progress." And it's just a few dishes. It's just a few dishes. But having that support is crucial, and having that awareness of like I did something that normally my brain isn't able to do because my doctor helped me, and now I can go back and say that this is positively impacting me. And that usually doesn't happen in my life, and it's such a fun thing. Um, my mom is calling me, so I'll be right back.
Hey, Toaster, you got that? Oh no, you did answer the question. Anyhow, I forgot.
Let's see if anybody can relate to this one. Somebody says, I'm struggling hard with taking my epilepsy medication. I've been taking it for years. I feel upset with myself. I'm so upset with myself. I know I need to take my medication, and I'm struggling hard with just by taking them daily. I've had seizures while off my medication, and my doctor has no idea I've not been taking them. I take the bubble packs, and they have been piling up in my cupboards for months. It's embarrassing to even look at. I feel sick to my stomach, but I also, since being off my medication, feel better in a way. My medications made me gain weight, and being off it, I've lost weight. I want to be my old self again. I've been taking the same medication since 14. I'm 27 now. And at this point, I should really know better. Has anyone ever struggled this bad with their medication? I feel so embarrassed and should definitely talk to my doctor about it, but I don't want her upset with me. She's very understanding and a nice person, but I'm unsure if she would be so nice about me not taking my medication. Okay, so I had to read that out loud to actually even hear what this person was saying, that they wanted to be their old self again, and that's why they stopped taking their meds. But honestly, if I started taking medicine, the same medication that I was taking when I was in my teens definitely changed late 20s, before I was 30. So I could understand why those medications just don't feel like they're doing it for you anymore. Anybody else?
The thing where you said you had to read that out loud to understand, I get that. I get my words jumbled. I forget what line I'm on if I don't read it out loud. So yeah, that reading out loud is something that works. It might be epilepsy, but it works for me.
Yeah, maybe
Kind
yesterday's
of.
seizure lasted a little longer than I realized because I've been really like loose-minded all day, lost words a lot.
Go ahead, Toaster.
The epilepsy medicine is like any other medication, ADHD medication, depression medication, it doesn't matter. this is going to sound horrid, but you have to shop around for the thing that works. And side effects are a part of that. If the side effects are making your life more miserable than the seizures, then you yes, talk to your neurologist. She will get it, and if she is truly a good doctor, that is, she will get it and she will help you out. Don't stop, please don't stop. Just talk to her. Just talk to her. Yeah.
Sounds like great sound advice.
Yeah, most of the comments, it looks like we're reading, just don't criticize yourself about it. It's not anything to be ashamed of. To need to talk to your doctor about the medication if it's not getting the job done.
I got something here, Kate. This person needs advice. They said, I just don't know anymore. I take care of my disabled older sister. She has seizures from an old TBI or an old TB that occurred when she was only 3 years old. Physically, she's 43 years old, going on 42 in September. But mentally, doctors say she's 3 years old. My sister moved in with my wife and I on June 1st. My sister has the VNS implant and just has the battery replaced on July 3rd. Before the replacement, I stayed with her for 5 days at an epilepsy monitoring center in Orlando. While there, they were monitoring to see if she was having breakthrough seizures while they were monitoring her via EEG. I was writing down the seizures I saw and had to push a button every time she had one. Well, today was the follow-up to find out the results. According to the neurologist, my sister didn't have any seizures for the entire stay. I recorded at least 10 mini seizures, with 8 of them being on one day. They even have video of my sister looking like she's having seizures, but according to the EEG, there were no seizures. The neurologist says she normally refers the patients to psych when they get tests that show it not as a seizure. My sister has been faking that she's having seizures. I don't know what to do anymore. Why would she fake something like that? Why would she do that? The neurologist showed me the VNS readings. The VNS has been doing its therapeutic job, and there weren't any signs of seizures. The neurologist says it's a behavior issue. Why would someone fake a seizure? I don't know. Why scare me like that? Who does that? I need advice on what to do about all of this. I just don't know what to do anymore and how I could be of any help.
Something that I never thought of was, it looks like one of these NIH, .gov articles is stating that a non-epileptic seizure that mimic epileptic seizures but have no EEG correlate, it sounds similar to an absence seizure or one of those nocturnal ones, because it says that those are statistically less proven to shown EEG abnormalities. So I would honestly definitely go for a second opinion first thing on that one, because you know sister best, and definitely don't let the doctor come in between you guys if, by accusing sibling of faking it.
Go ahead, Toaster.
I'm confused. Did the sister admit she was faking them? Because PNES is very, very, very real. I know that. I know. Oh shoot! Actually, I don't. I do know. I just can't remember it right now. But a lot of people who have epilepsy also have PNES, and I'm trying to remember how. I'm trying to remember how Dr. Parikh described it. I'm sorry. And I
Are you making
remember
the
I'll
point
say
that
again.
PNES seizures don't show up on an EEG?
Yes.
That's
Yes.
applicable
Yeah.
to this one.
That's what you already said. Sorry. But I am agreeing with. I mean, Listen to mom.
Hey, can I just throw in what I'm picking up here?
You can throw in anything you want.
Where she said she feels like her sister is faking the seizures. She's been doing this all along. Why would she do this to me? Why would anybody do this? Why would she do this to me? She's taking it personally and not looking at it as something that she just doesn't completely understand. And yeah, we always get referred to psych when they can't see the seizures on the EEG because the wrong specialist looked at the EEG. So, we know it's a process, but the thing that I really get bugged over is how other people think that we're doing this to them personally, and oh, you're faking it. Psychogenic non-epileptic seizures are very, very real. And they may not show up on an EEG, but they'll show up on a functional MRI. Yeah, so, but the whole idea that this family member is saying, why would anybody do that? As if this person's doing it intentionally. And then why would she do that to me? She's taking it personally. So maybe family counseling would be a good idea if this person's going to have to go for psych or any therapy. It wouldn't be a bad idea for the whole family to join in a few sessions. That's yeah. That makes me sad.
Yeah, I understand what you're saying. That makes you sad.
Hopefully they catch our feedback this episode,
We need second and third and fourth opinions around here. But I'm going to start with this one. It says 1,000 milligrams tapering. I've been tapering for 4 weeks now, removing 250 milligrams each week. I'm finally off yesterday. What side effects are normal that I will have, or what side effects that are normal that I will experience? This person doesn't says what medication, which also says a lot in the comments. Is tapering bad?
You're saying this tapering off of the meds or like titrating up to get on
It
it?
says tapering. I've been tapering for 4 weeks, removing 250 milligrams each week. I'm finally off yesterday. What side effects are normal that I will experience?
I would assume you'll have a seizure. I mean, like you said, depending on what medication, because half of most of the Keppra tablets are over like 200 milligrams, but chances are you'll definitely have a lower threshold for seizures.
There's a comment here and it says, unless it's a benzo, coming off clobazam was hell on earth for me, and I tapered it slowly, following the doctor's guidance. First night of decrease, I couldn't believe how shifty I felt and shitty, but didn't get better until I was completely off for for a couple weeks. Someone else said, shouldn't really matter what meds you're coming off of. It more what, if any, you're increasing. Whatever you're coming off of, you'll feel relief. Even with things you didn't realize you were dealing with side effects, you should be shocked with how much we get used to living with on a daily and just get accustomed to it. Happy for you. Hope it works out. I like that comment.
I guess I've sort of like tapered, but not that I was like getting different meds. Like I wasn't actually going to my neurologist for this. I was just kind of I swapped to doing it was 18-hour like runs on my pills instead of 12. Um I was trying, and then at one point I was doing one pill a day. Um like after doing the 18-hour runs, which got annoying because you have to like take one either crazy early or like super late at night, so it gets really weird. Um, and I would feel fine for like a few days, but then after about like 3 days or so, I would start to feel like I was going to sneeze again. Just being on like not the 12-hour schedule, you know. So it's not. I don't know. I tried it. Doesn't work.
Anybody got any advice on tapering?
You mean just tapering off any drug in general?
Yeah, basically that's what I'm getting because they didn't have any specific drug.
Well, I'm just coming off of Depakote slowly. Um, I mean, if your doctor thinks it's okay, and you've been having less seizures, uh, it should be okay. I mean, that's the ideal goal, is to come off drugs, uh, always safely, uh, but only if you're ready, or if you're switching to another drug.
How does it feel coming off one drug? Do you feel any different?
Yeah, actually, I think I have noticed that I'm taking less naps during the day. Yeah, that is one thing I have noticed. I'm not as sleepy during the day, but I am still a little fatigued. Like I'm not like jumping up and, hooray, not like super energetic. Though I still feel the drugs.
You should try some of this. This
I'll get
beach
right
ball,
on it.
get some energy. Shout out to Nature's Made. Anybody else opinions on that? No. I got
Tapering
something.
off
Okay.
one. So, sorry, I forgot.
Go ahead.
Um, Tapering off one drug is always going to be difficult because your body is already used to the side effects. And so now you're thinking, is this me or the drugs? Because you're noticing less and less side effects. Actually, this doesn't make any sense. Never mind.
It's all
No,
right.
I agree. That's how I came to the conclusion that the clobazam, the benzos, are so much more powerful than I realized because it's such a tiny pill. They're telling me to take 6,000 milligrams of Keppra every day, but one little itty bitty benzo, and that's what fuck with me even more. Because now that I'm done with that one, I haven't stayed up all night in a long time, and now it's happening at least once a week. And actually getting, still being able to get things done and get the workout back into the routine and all that. So the benzos make a way more of a difference than the AEDs for me. So that's kind of, I think, where you're going with that. After you're taking one of these strong medications for a while with pretty powerful side effects, you don't really realize it's the medication anymore. For me, it's because I forgot. I wasn't keeping track of, the daily schedule that I maintained before that because I only write down when I have a seizure.
I got something else here. It's different. Someone says, I need some advice. Please help. No diagnosis, feeling frustrated, 2 emergency room visits, many falls, many tests. Still no diagnosis. It's been almost 6 months of hell, many seizure-like symptoms, as the ER staff calls them. They ask if I am medicated for them, and I have to say no because I can't get access to anything that might relieve me. My neurologist won't approve Keppra or any other seizure med until we can prove the seizures, but plenty of migraine meds that don't do shit for me. 3 MRIs, 2 CTs, a sleep study, and an EEG that I will have results for on Thursday. I am feeling so defeated. I mean, I know that if the EEG is inconclusive, it doesn't mean no seizures. It just means no recorded seizure during the session, which for 2 hours is very much a non-answer. Meaning, my experience is an absolute laundry list of things that freak out all the lovely people in life. I've had episodes while in a Discord call with my gamer fan, hitting my head on my desk. I've had epilepsy while in the bathroom. Um, I've fallen many times. I've bit my tongue many times. I've woken up dazed and confused with my poor husband hunched over me, crying his eyes out, afraid of me, afraid for me. I'm losing words. I have trouble with speech. I'm exhausted all the time. My neighbors look at me weird for being a young lady with a cane when I can go to the mailbox because of my balance issues after an episode. I have to wear sunglasses to go shopping because the lights set me off. I can't drive because I don't feel safe, and the vertigo and lack of focus is too intense. I lost my dream job because I can't work around the fog machines and strobe anymore. And my boss can't put up with me being out months and needing constant accommodations without proof. I'm just freaking fed up. Anyone advice would help.
Wow. Can I jump in there?
Go ahead.
Sounds a lot like me, except for my seizures are not like convulsions. But it's hard when there's so many things going on at one time and you're not sure which thing to tackle. But I always say it can't hurt to get tests because then at least a test can help you to see what is wrong or maybe rule out some other things like get your vitamin levels tested. I've learned that B12 deficiency can cause some really crazy um, neurological symptoms. And get some other things tested while you're getting the EEG done, and also realize that you're probably going to need like a EMU stay if you really want to get a good EEG, because 2 hours is not going to be enough.
Anyone else opinions on that?
That makes a lot of sense. That's perfect advice, a way to break it down because that person definitely did sound overwhelmed just since there was so much going on. So I think Nikki laid it out perfectly.
Okay. Got one. Panic versus temporal lobe seizure. I'm a parent trying to figure out what's happening with my 10-year-old child. My child has a history of head injury, concussion, whiplash 2 years ago. It's a long story, but it happened during morning fitness in class. But the teacher didn't realize my child then went on a centrifuge style spinning whirly gig during a few hours later before coming home at the end of the day, visibly dazed and disheveled. Since then, there's been all sorts of low grade neurological issues. We've done a lot of work with a neuropsychotherapist for untreated whiplash, neck pains, neck, neck, neck proprioception, balance, plus identify some dysautonomia, dysautonomia, autonomia, I think that says. Yeah. Or seen an orthopedist for eye issues, accommodation, convergence, photophobia, and then a pediatrician and psychologist, etc. My child spaces out for a few seconds multiple times a day. We haven't been managing significant mental health issues, nightmares, daily intrusive thoughts, panic, terror, it all still continues despite being on a daily SSRI and intermittent propanol, plus having done extensive psychological therapy, mainly prolonged exposure and trauma-based CBT. My child is a shadow of their former self right now, and I'm trying to recalibrate and figure out the plan of what to focus on to lift my child up and help. I'm planning to look into more trauma-based psychotherapy, plus more psychotherapy to make sure posture and neck strength are both back and cared for. The reason I'm here, we never see a neurologist or had an EEG. Though I'm a pediatrician, has now referred us this week. I've been reading about the potential for focal seizures to have auto, autonomic presentations, plus that temporal lobe partial seizures can manifest as panic disorder. For those of you who have experienced this, do you think it's plausible? I can give a bit of more history if needed, but basically, I'm walking that thin line of not putting my child through too much medical investigation unless it's necessary, but also not wanting to start things like more trauma-based psychotherapy if we haven't treated any underlying cause. There's also a real shortage of underlying cause. Oh, there's also a real shortage of neurological services in my city, so demand for appointments is high with long waiting lists. My child doesn't vomit, though does sometimes feel like it. There is no loss of urinary or bowel control. I feel I don't feel twitching. I don't notice twitching. It's more intense anxiety, stress responses, brain fog, not hearing people, seeming to switch on and off and go somewhere mentally for a moment or two. We've also had issues with falls during physical activity, with several broken wrists, which have been increasingly severe. My child was unable to properly attend school since the injury due to his post concussion issues, then its intense stress responses, but is now attending more. Classmates have observed that my student is weird, and I know my child is being left out behind socially. There's a lot going on, so it's hard to take stock and figure out where to next. I appreciate the time you spent reading this, and I am also aware that many people here have far more intense and debilitating epilepsy. Plus, I could be on to something or on the wrong track. Sending lots of positive thoughts and happy for all of you to get medical care and support that you need. And thanks for the advice.
Oh, I love this person. They're so nice and they just want help.
Yes,
Yeah,
I had to
I
read
think
all of it.
they it it sucks. People don't realize how much just getting the whiplash, not even the concussion, like any sort of injury to your spine, um, can lead to like a problem in your brain. It all goes up. It can lead to neurological problems. So I feel like if he's being left out, it's because people just don't understand that. And saying he's weird is, I mean, that's just the wrong word to use. But kids are kids, so they're gonna say that and act that way. Um, but yeah, I think they really need to get him in to see a neurologist. The word psycho was used so much. I like it became a sound at one after a certain point. Yeah, I feel like they need to get in to see a neurologist or an epileptologist, as well as whatever else they're doing, because this sounds pretty.
I'm
Yeah,
wondering how they've all these other specialists have been able to kind of cooperate and work together too, because if this mother's had her child to so many different doctors, they should have been able to come up with something by now, at least, even if not a cure, something in the right direction of let's do this for now to manage this so it doesn't get worse. Because like you said, with those kind of injuries, it all goes up, and if it's not being maintained, then it could easily get worse.
And with a
So
concussion on top of
yeah,
that, this kid has had some serious,
yeah,
trauma.
that's what Nikki said in the chat. She summed it
Yeah.
up when she said, "Oh, this is serious," because
Yeah.
involving that many specialists and those injuries. Yes, let's hope they can definitely work together and get into the right specialist.
Yeah, that's what I was gonna say. If I was the DNP I wanted to be, I would have this mom take her son to an ENT, an otolaryngologist, because it started with that centrifugal force, and that can unsettle the cochlear crystals. And it can start a series just like they're going through right now. And it's a chronic vertigo that later on can go unnoticed and rear its ugly head later as PNES, because they don't know what else to call it and they've forgotten to look at other things. But it sounds like it may have started with that spinning, and this child may only need some physical therapy to readjust those crystals in the inner ear. And it isn't hokey pokey, it's a very scientific kind of thing, but I would highly recommend an ENT for sure. It might not be neurological, it could actually be, something that's, similar, and I always spell it wrong. It's called Meniere's disease. And Meniere's disease can be the number one misdiagnosed thing other than focal epilepsy for seizures. So, it's always good to, this is what I love about our group. It's like, oh yeah, no, I know somebody who had that happen. And she was this wonderful, sweet woman. She was a cosmetologist. And she was sitting back just giving one of her clients a facial while the clients reclined in the chair, and Penny was sitting on that little, like a shop chair and doing a facial massage. And she literally, her body threw itself off of that little chair. And they didn't know what was going on. And it started happening more and more. And they're Johns Hopkins, they're like, well, seizures don't always come from epilepsy. So, and that's where I learned about that. And I'm like, no kidding. So, this is something we always think, oh, a seizure is epilepsy. Not always, not always. And my hope for them is that it is Meniere's or it's a cochlear imbalance. That's easy to fix. So, but yeah, they might just be knocking on the wrong doors. And, an ENT can evaluate any physical issues from the skull base all the way down to your ribs, to your heart. So they'll know, they'll find it.
I think you guys were very helpful. After reading a lot of that, I kind of forget what it's about, but you guys brought it all back to me. And there's a lot going on there. Hopefully someone she'll see this and she'll get her answer, or at least some advice from you guys. I thought you guys were great, but that's personal opinion. Anyhow, next question. It says, son diagnosed with JAE. Now what? My 11-year-old son has tonic-clonic seizure a couple of weeks ago out of the blue. Otherwise healthy, athletic kid. He earned himself an ambulance ride, a series of doctor's appointments, an EEG, and a new shiny diagnosis of juvenile absence epilepsy. He also got himself a prescription for lamotrigine. We had not ever noticed any absence seizures, maybe a couple of very brief moments where he lose a train of thought, but who doesn't do that occasionally? And never raised an alarm or bells, nor did it seem much different than something our other kids have done. I'm not sure if those were seizures, just fairly normal moments of spacing out. I feel like I will forever be second guessing every one of those moments. Right now, we're all trying to wrap our brains around what this means long term for him and our family. He's about to start middle school, and that's an environment where being different can be exceptionally hard. He loves baseball, likes to eat, sleep, breathes baseball. He also has been looking forward to when he can drive and already knows exactly what he wants to drive, wanted to drive, question mark. Maybe that's past tense now. I don't know. I'm putting on a brave face, but I'm so worried about where life goes from here. Do we go on assuming meds will work? Life continues as planned and pivot only if things go bad? Does everything change now and we reevaluate all priorities? I am a planner. My brain needs to know what to expect, and I'm having a really hard time wrapping my brain around all of this. A month ago, none of this was even a, a sliver of an idea, and now it's reality. I'm glad it's me and not my children. I could say that. Because I don't even want to help this person. I was hoping you guys would, to be honest. I'm not good with advice. Come on,
Well, I
guys.
would
Come on,
definitely
Toaster.
agree that it's, you're glad it's not your children, but I mean, when I'm at a loss like that, I would just recommend one step at a time. Listen to either one specialist or, take on one symptom at a time.
Toaster. Come on.
Pretty much the same thing that Kate was gonna say. Just one step at a time, liet liet in Hebrew. Step by step. Okay, sorry. Didn't mean to bring. Well, it's a language. Yeah.
Oh, actually, wait, did you say Liet? Liot.
Liet liet.
Oh, okay. Yeah. My partner's best friend's name is Liot. Yeah,
Oh.
yeah, so that's why I asked.
Liat is actually a male version of Leah.
Oh, which is funny because uh she's female. Anyway, or you know.
Well then.
Or you know.
Now you know. And that means mother in Hebrew. Well, also means cow. Cow and mother depends.
Yeah. We learn something new every day here.
Kevin, did you have something?
Suppose it's tough to imagine being on that, we're all so many of us have been um the person with the condition, but seeing it from the outside and all this happening um right away. Yeah, I mean, just step at a time. I guess the first step would just don't panic or anything. Don't just, if any issues arise, yeah, this is just the beginning. Just, yeah, I'm not. This is certainly not the end of the world. Things are gonna just change over time. Always know that. You mentioned driving. That
Let's hope.
Yeah, maybe. I'll throw a maybe out there. So we'll just see where it goes from here.
We're basically at self-driving cars anyway, so I think all of us are going to be getting vehicles pretty soon.
Yeah, I mean, we all have different. Um, every epileptic is different. Every condition is different, and yeah, it's so you know no worries. I mean, always be concerned, but you know, just okay, just bring it down. You know, you can just be concerned for your child, obviously, but you know, this isn't the end of the world. Uh, that's all I can say.
That is the last thing my mother wanted to hear. This isn't the end of the world. Ooh. It's a rough thing
I
to
don't
tell a
I don't
parent.
know if that's good or bad advice. I just
Oh, to tell a parent that's rough. This isn't the
well,
end of the world.
that's what I would tell a parent.
I got you.
That's that as a kid, you know, being
That's from
diagnosed.
someone who doesn't have children. I could say that. But yeah.
I, I I don't
Somebody
have
tell me,
parents.
no, this
Or
isn't the
I
end of
know.
the
I mean,
world. I don't
I
want
have
to hear
parents.
that.
I don't have kids, so I don't know how to empathize with y'all.
Yeah, I feel you. But yeah, just I'm letting you know to tell someone
So
about their kids, they're gonna go
maybe,
off.
maybe that was a big strikeout there.
What would you say about this little man right here? He's got the little doo-doo emoji thing pulled up and he keeps putting it on my face to make Nana laugh. He figured this shit all out on his and he's 4. And he figured out how to cover up somebody's head with but that's the one he goes with. Not the elephant, none of the other animals. Yeah.
I
So
saw him
Kevin, what would
doing.
you be your
Oh,
advice for this one?
oh, for him, just you're gonna be fine. Uh,
Love the support. Love it.
for a
I saw
kid,
him
yeah,
doing the
you're fine,
claw,
man.
like making claw motions or something. So I was trying to do it back to him, see if he noticed.
I say a
Man,
few things will change. Got to alter life a little bit because of his condition, but don't worry about it too much. Just something you're gonna get used to. If you worry about it now, it's not gonna get better.
Also, hey Jeff, what's up?
Hi, how are you doing?
How you been? Where you been? We've been waiting on you.
I have a cold, so when I left, I went to bed.
All right. Got something here, y'all. It says, I know my mom is trying her best, but I'm actually starting to fall apart by how people talk to me about my epilepsy. For context, I have had tonic-clonic epilepsy my whole life, and I'll have a breakthrough seizures randomly, and it normally happens when I'm going through hard times and sleep deprived. I've been seizure free for 2 years, but now I recently had one, so I got on another med to control that. It was relatively normal for me, and it was way less painful than the other seizures I normally have. This one looked really bad if you were spectating. So to my mom, she was definitely traumatized. I'm all good, and like usual, it was hard. I had missed a dose and hadn't slept all week, so not surprising. I'll be going to college in a few months for my master's. It'll be my first time at an in-person college. I'm able to drive. I had to take 3-month break, but because my recent seizure, everyone is worrying me. I'm not mad because people are worried. I'm starting to feel insane because people keep making me feel incompatible. My mom feels the need to remind me in almost every conversation where we talk about the future. It does not have to be involved driving. I can be excited for different programs or events or opportunities at college. It is legit, doesn't matter what it is. The topic of car is definitely worse, but I'm starting to get mad at every time someone does it. I don't care if it is well intended. I don't need to be reminded. I live with it. I take care of it. I have to look out for myself, my diet, my stress levels, my sleep, everything that could be possible to have an impact. I can empathize with others that care about me, but if they care so much and don't keep acting like this, while it is well meaning when I ask my mom to just stop saying things like that out loud or consider my feelings, she was basically like, I'm worried and acted like there's just nothing she can do. She also told me, well, if you don't want an answer like that, then I shouldn't say something that involves risk. Like that doesn't mean everything ever for someone with epilepsy. I don't feel like my request was unreasonable. I'm not trying to be an asshole, but I feel like the last person considered this question. Yeah, the last person considered in this question. I'm lost, you guys. Come on. No advice? Person's looking for some advice.
He wants
Yeah, I
to
think
drive.
we got kind of lost on that one. Go ahead, Brent.
Yeah, I'm so lost at the point. They needed to do a summary at the bottom.
Yeah, might need chat GPT for all that.
Yeah,
Uh,
I flipped past one of those before too. This one is somebody saying about an hour ago, 12 years down the drain is the title. 12 years seizure free just to have one. I've been on Depakote, which has worked 3 times a day. A little less than a year ago, I got unexpectedly pregnant and terminated due to the risks to the fetus, which devastated me. I've had a baby on this med before, and he has a slew of issues, but being that it's been so long without a seizure, my neurologist was okay with me lowering my meds to try for a baby again soon. I was down to 1 pill a day for about 7 months and prenatal vitamins. I was getting hopeful. Over the weekend, I had a night of about 4 hours of sleep before a trip, and bam, the next morning, had my coffee and had a seizure in the Uber. There's that caffeine. I'm so sad. I know this takes away the chance of another baby, and I also know now my epilepsy is not controlled outside of the meds. I'm now on 2 times a day and going back to 3 times a day soon. I'm so confused, don't plan on driving till I'm 3 months free, but I've never felt this fear ever. And I've been driving for 16 years. My last seizure was during pregnancy 12 years ago while sleeping, and I immediately got back on full dose of meds, and I've been okay since then till now. I felt normal for over a decade. Epilepsy rarely crossed my mind, trying to see the bright side, but I don't see one. My whole life has been flipped upside down in one day. Yeah, you can tell they're back on, almost like that initial diagnosis feeling. That's what I'm hearing. What do you guys think?
There's so many factors here. Like, well, obviously, lowering the meds, yes, that's going to be, an immediate factor. Wanting to get pregnant, there's some stress right there. It's been 12 years though. That's a really good friggin' run. Like, they can't discount that. That's a great run. And clearly it's just because the meds got low. The epilepsy was never actually like, I mean, it was controlled, but it didn't go away. It was still there. It was just the meds were stopping the seizures, and now you're not taking as much meds, and you're drinking caffeine.
Toaster, you had your hand up?
Um, um, okay. This is coming from someone with an oops baby. And just greatest treasure on the earth. But I have to admit, he was an oops baby. And then after I had him, sorry, this sparking in my brain. I remember having a conversation with my then neurologist, who was my very, very first neurologist, about Depakote and how she did not recommend me going on Depakote if I ever wanted to have kids. And then come to find out that it's oh shit, I forgot. Shit. Oh yeah. a lot of women actually, not every single woman, never, ever, 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 every single woman, but a lot more women than you think actually have less seizures during pregnancy. Now, of course, you're still going to get the monthly checkup and everything, but yeah, I wish I had stopped the Depakote for my second baby, and I lost and miscarried. So I definitely don't recommend any type of Depakote. So maybe look for a different seizure medication that's along the same lines as Depakote. I mean, that's just coming from me. Talk to your neurologist. Yeah.
So what I'm seeing is that from Depakote it is valproic acid, and it looks like what the first thing that comes up on its impact on women is that it just causes menstrual irregularities, sounding like it makes it harder to get pregnant. So did they
It
blame the
helps
Depakote
mass.
yeah,
Yeah.
go ahead.
Yeah. They told me I was something about that valproic acid actually helps lower menstrual cycle flow, and so it is sometimes used for women who have really, really bad cramps.
But anyhow, this one says epilepsy and menstruation. That's oh, okay, I know what that is. Said anything hurt or help, any impact from birth control. Has anyone had success or failures dealing with epilepsy that is affected by menstruation, e.g., birth control, hormones, IUD, etc., or taking any rescue med? I hear this is called catamenial epilepsy and that a lot of administrators get it. Context. I'm on epilepsy med, which keeps tonic-clonics at bay, but still get auras, jerks, etc., and it especially kicks up a few days before my period, and occasionally, but less often, during ovulation. Things I've tried: geniclia, and for instance, norethindrone, but it made it worse when I didn't menstruate and better when I was on my period. Then I was bleeding, spotting every day, and I didn't love that. Lorazepam I took as needed, but to be honest, its effects lasted longer than the aura and jerks. And it makes my day shot. So I don't love it. What else should I try? This is specifically to the ladies.
Okay, so it sounds like they're trying to narrow down what medication might not have such an impact on them, if I got it right. For me, the Keppra doesn't mess with, that aspect, but I don't think honestly I made note of any medication ever. If I never took any AEDs or like any medication for epilepsy that I felt like actually affected the cycle. Now, when I took the seizure pills at the same time as the birth controls, then things got kind of thrown off track, if you will, and it was always worse to have the cycle after skipping 6, 8, 10 weeks. Then I kind of knew when the seizure happened that was an indicator that probably was coming back. But that's the thing, I never had any warnings, so maybe this person just needs to keep track of their own symptoms and learn how to figure out which signs their own body gives them about either the seizure starting or whether or not your menstrual cycle even really has an impact, because sometimes mine just feel really random too. What's up, Toaster?
Adding on journal, journal, journal. Always journal.
I
And
agree.
yeah.
That's how I figured out that my cycle, I mean, it's like the main thing that's causing me the problem. And I showed my doctor, and he was like, I know nothing about that. So,
Okay. So this is how I do it. I got these questions from a book on psychogenic seizures. And it's, where were you when the episode started? What happened? I mean, it says episode, but you could just replace that for seizure. And it's that answering those as soon as I'm aware really, really helps. And I actually think one of you gave us the idea of my mom putting down the times in which I become aware enough to answer these questions. Because
where
that's
do you
also
get
a
the
thing.
questions
We
from?
notice that if I'm awake enough to answer the questions within like 20 minutes, it's more likely it's going to be a photogenic, psychogenic seizure. If I am out for like 45 minutes or more, that's definitely a epileptic one. And that part has also helped.
What were you saying, Nikki?
I was asking where did the questions come from?
Oh, a book called, where did I put it? Give me a moment. Oh, there it is. Psychogenic
Oh,
Non-Epileptic Seizures, a guide by Lorna Myers, PhD. I found this book while packing up my dad's books. He got that so he could understand them better. It made me feel so wonderful when
oh
that happened.
wow. Oh, nice.
Yeah, he's let me steal it. He's already read it. And it's actually really, really good. And it explains where my mom got the questions from.
Might be able to answer some of those questions. But I'm gonna go to the comments of this one. It says, my jerks were the same, always a few days before my period and sometimes into and during ovulation. I started the depot shot. I know there is controversy around it, but I find that it works for me and it has completely stopped my period, which has also stopped my jerks, except the occasional random ones. I know birth control, especially one that completely stops your period, isn't for everyone, but in my situation, it has been a lifesaver.
Yeah, I mean, whether there's controversy or not, if Depo works for you, the controversy that I remember people throwing at me was that it hasn't been out long enough, so you don't know the long-term effects, so just don't be on it for too long, and you know, it's all right. Served its purpose while it lasted. Fuck quarantine. That's what I have to say. Love my little one, but he is a quarantine baby.
Oh, yeah. Know a few of them. I'm gonna go ahead to had a different type of seizure, landing me in the hospital. I had absent seizures that only last a few seconds. Wednesday morning, I had a convulsion, one which loved ones never saw. From shaking so much, I bit my tongue, and my family thought I died as blood came out of my mouth. They weren't sure what to do because this never happened to me. Turns out it was due to the low sodium, which caused from my meds. Ended up having one while in the ICU as well. It was a very scary situation. Ambulance took 10 minutes to come to my house when they were up the street, but felt even longer because how traumatizing it is. Now my meds need to be adjusted. This was probably worse than my first seizure, given I was awake and knew what was going on after I had my normal one. This had nothing to do with my epilepsy, which made it even scarier. What's going on? You guys, I need some advice from this. Kate, what do you think? Toaster, what do you think about that?
I had a conversation in the background. I'm sorry.
I might have to move forward. Liz, welcome back. You got an icebreaker if you're there.
Yeah, it's good to be back.
Yeah, I'm glad to see you come back. I know you like it then. I got an icebreaker for you, and it was, what's something you did to improve your quality of life once you had epilepsy?
Ooh, that's a good one. I don't know, maybe I don't know, started focusing on maybe like more artsy stuff. I got into like drawing and all that fun stuff. I don't know, maybe just like sense of control and creating things yourself.
That's a good way to explain it. Having control over the activity is probably what brings all of us some peace as Brandon picks up a guitar. Great example.
Right, the next one I'm going to move towards. It says, what can I do? So you guys got to pay attention because that's the question. What can I do? How do y'all manage your seizures? I don't have rescue meds. I don't have a diagnosis because I can't get into an EEG, and I'm about giving up on that. And they're just not great. I have meds I was prescribed for mood stabilization, but in reality, my doctor just got them for me for my seizures since no neurologist wants to see me because I have functional neurological disorder. It's just weird. If they was functional seizures, why do the meds help? Then I get triggered by light and stuff. Well, the question is how to manage them. My spelling is bad, getting worse. My speech is not doing great while I can still talk. I stutter and mispronounce words. I can't remember much half the times. I don't remember my childhood much anymore. Maybe trauma or this, I don't know. And I feel worse. The meds are helping, but I'm still declining and I don't know what to do. I went to the ER because I went to the ER because I went to the car and have FND. They didn't want to send me anywhere else because though I couldn't even walk, talk, head was bent, bad pain, and was basically immobilized. So I didn't know what to do or where to go or how to manage anything anymore. Do I wait till another major one happens and call 911 like a doctor at the ER said to do? Do I keep pushing for an EEG even though it's been since March? Since I've been looking, how do I even get my license and drive? What can I do again?
Well, if you're still having seizures, don't think about getting your license back anytime soon. So as far as pushing for the EEG, then it sounds like that's the way to go so you can get it diagnosed and treated and, take the next step. What do you guys think?
I always say second and third opinions help.
Yeah, I agree.
Especially that second opinion. Then when you get a difference from that, you don't like that one, then get a third. Do the best of three.
Yeah, I mean, the functional, when they said something about no neurologist will see them, I don't know if that's a misconception or if that's really true for them, or did one of their doctors say, no neurologist is going to help you with this? Do you know what I mean? And how words can affect us. So I don't know if that's really true and if maybe they should be seen by an epileptologist or, yeah, I don't know. I mean, all the trouble that I had getting to my diagnosis, I don't think I have any good advice because it took me 4 decades. So You know, I don't want to be that morbid person and say, well, I guess you just have to wait until you have a catastrophic seizure and you go into a coma. Because that's how I got my diagnosis.
Oh,
You know, I don't even know what to say, but as far as managing seizures, B12, okay, I'm noticing the difference. My doctor's on board. Ashwagandha, as long as you don't have a problem with that, it calms me down better than anything else I've tried. And it does make me a little bit sleepy, but that's because I'm sleep deprived right now. But I'm actually welcoming that. But as far as managing seizures that could be epilepsy, you know, we definitely don't want to see that person doing anything like drinking themselves to sleep every night. And then, but hey, there's a way to get a diagnosis. Sorry, morbid again.
I mean, if you stop just short of morbid, then they could still make progress, but more along the lines of don't accept what they're lying about, because neurologists do play a crucial role in diagnosing PNES, FNES, anything that says epilepsy. It's a neurological condition. So this one is definitely somebody probably surprised, and I don't know what word to use, but disappointed to say the least by that doctor's diagnosis. Still doesn't mean you need to accept it.
So I have a question. So neurologists can diagnose PNES, but who treats it? It's the psychiatrist treats it, right?
I have no idea.
Exactly.
I'm trying to figure this out.
And that is exactly the argument that I used to pin the epilepsy center that I go to into a corner, because they are required to treat psychogenic. If they're going to diagnose it, they have to treat it. And that isn't just because they diagnosed it. It's because that's required in the regulations, for their accreditation. So, that was exactly what I used. It's like, yo, you're diagnosing me with this, but telling me to go and hunt down a non-existent therapy. I don't think so. But I'm kind of getting the vibe from this person that they kind of wanted it to be epilepsy because it's a little more common and maybe more acceptable. And once you hear that you have to go to a psychiatrist for further evaluation, it's like, oh, hell no. And that's where so many people stop with an epilepsy diagnosis and not even realizing that that could be a vital part, because the psychiatrist could turn around and say, this patient of yours had a seizure during a session. It can happen. And but the functional neurological disorder, that's another huge umbrella term that, some providers will call a garbage bag diagnosis, because it covers everything from spinal pain to psychogenic non-epileptic seizures, which that definition includes a panic attack and a shiver you get after you yawn. That is actually under the definition of PNES. So using those broad diagnostic terms needs to be reconsidered in our healthcare system. So, but it does kind of sound like this person almost wanted it to be epilepsy, but is afraid of something that they don't understand, because maybe they understood epilepsy a little bit more. I can relate.
Talk about feeling like you're starting over.
Because you don't know what to do next. Like they don't make it clear after the diagnosis. What do you do about it?
Right. But like I said earlier, if this is a doctor at an epilepsy center, whether you're still seeing them or not, if they diagnosed you with psychogenic and then sent you to look for your own therapy, that's a violation of their agreement with the accrediting body. So they, the state health department knows these things, and that's like the liaison. And if you don't get a response from them, then what you can do is you could contact the NAEC, and they'll tell you the same thing they told me, that, they don't have patient advocacy, but they do take these things under consideration. And in my case, there were several reports of a violation against the epilepsy center I'm going to. So they said, okay, we're going to look at this. And, there's always a chance. And sometimes it only takes one voice, but knowing what resources that you have, and that's why, like with you, it's so similar to so many of our stories. It's like, especially women, we get blown off. It's this, it's something else, but we both had a history of juvenile epilepsy. So for any epileptologist to say it's impossible for you to be having epileptic seizures, I would question their license. And to do that, you have to report them to the state.
How would you go about doing that? Reporting someone to the state?
Yeah, in the United States, every single state has their own Department of Health. You Google your state Department of Health, and it's usually under like for me, NewYork.gov, and then the department takes you to another website. And you can find in there, it might take some looking, patient rights, the patient bill of rights. And once you find that, you can find, they give you the information to file a complaint. The other way to get that information is when you go to a new doctor and they have you sign all that stuff on that signature pad, and you do not know what you are signing. One of those things is your patient bill of rights. And at the bottom, it gives you the address, the phone number, and everything for you to file a complaint against those doctors, which is why they stopped printing those out. But you can go online and get the same information for your state. And if you need any help, just holler.
Yeah, I'm looking it up right now. That's valuable information.
Yeah, it is. It changed. It was a game changer for me because, I had doctors come right out and say, "Oh, you come off as harsh and threatening and this and that." I said, "Only when you guys are not doing your job. And I know you're not." They never did convince me that I did not have epilepsy. And, they're like, "Well, we never said that." Oh, well, unfortunately, you put it in my records and it's right there, and the state just read it, because once I started reporting them and the investigation starts, they'll, in New York, they send you a case number, and you can take that case number and get a malpractice lawyer if you want, or you can just be aware that they opened the case, but it's completely anonymous. So the doctor doesn't know unless they can identify you by that complaint, which was really easy for these doctors to do with me because they put it in their notes. And the next time they saw me, it was like, "Well, I don't know who you think you are. That's no way to get the health care you need." Well, this is no way to pay off your student loans either. So, dude, you better, just stop telling me that I have psychogenic epilepsy, because it doesn't exist, and it just went on and on and on until I started filing complaints with the state. And finally, I went back to the original epilepsy center that started this problem 5 years ago with all of that ammunition. And, that some of my friends said, "You went in with all the aces." Okay. They had no way out. I call it the Queen's Gambit because I used to love playing chess. And my mantra is they were playing the wrong side of the board. Okay. They thought they were playing checkers when I was playing chess. So I flipped the board, flipped the table, and I got what I needed because I literally put this guy in the corner, and not blaming him because he was the new doctor for me. I simply said, I'm counting on you to be the liaison to change this. And if we can't, or if you choose not to, I need to know now. So if that was harsh, he didn't interpret that as harsh because he knows now that the way he treats me is going to save or fail the epilepsy center because they're already under investigation. So that's what that will do for you. And you might get some pushback, but you know, I understand, Nikki, that you've already experienced patient dumping, and it's almost obvious. It's disgusting. And for an epilepsy center to dump a patient who has epilepsy, not only is that a state health violation, that is enough. It takes one of those violations for the NAEC to strip them of that accreditation. So then all they can call themselves is a clinic. And they can't call themselves an epilepsy center. So when you have those resources and that knowledge, and you go in and say, okay, let's talk. And that's
Okay, I got another question. I don't know if this will help the other poster. They did ask me, my doctor did ask me if I wanted to be referred to another doctor and get another EEG in the same center. And I asked if I could get referred to a functional neurologist because they were saying that it was PNES. And that's when they told me that they can't refer me to a functional neurologist, I guess, because they don't have one. So I guess technically on their end, they didn't dump me. They did offer for me to go to another doctor. But then at that point, I was like, well, I don't know if I want to keep getting more and more and more tests.
Well, I just did exactly what you said. I left the doctor and the NP that I started with, and I went to a few other doctors, which that did not work out, and then went back to the epilepsy center, and I'm seeing a different doctor at the same epilepsy center. So I'm not going to tell you what to do, but I can say in my case it was worth it. Because they're going to read those notes too, and it might be, you know, they might just have a different perspective, or they may have taken that extra year of college, of, you know, post grad, so they know how to read the EEG. And sometimes that's all you need is to have somebody else read that EEG, you know. But I would definitely consider it, Nikki, because that's exactly what I ended up doing, just with a space of 2 years, you know, lapse of 2 years trying out these other, I call them Dr. Glow Sticks. Yeah, just didn't work out, but I'm back at the epilepsy center.
Right.
Hey guys, I just wanted to say I'm hopping off, but I hope you all have a wonderful rest of your night and weekend, and I will see you all on Tuesday. Okay?
All right. See you Tuesday.
All right. Later, guys.
I got to do the same, guys. Dinner is here, and we
Later,
got
Annie.
headboard. Yeah, I'll see you guys later. Best of luck,
Yeah.
Nikki. See you Tuesday. Have a great weekend, guys.
Oh wait, hang on. It's
What?
Tuesday. Oh wait, no. Sorry, I'm thinking about Femday Wednesday. My bad.
I know we should do this every day. Okay, my doctor already said that, so we got to talk. All right, love you guys.
All right.
Bye.
Bye.
So I got one here. It says my EEG showed epileptiform discharges, but my seizures are controlled. Is it bad if you're still having epileptiform discharges on an EEG while you're seizure free on meds. I'm nervous that my meds aren't treating me the best way if I still have epileptiform discharges. I was told the goal of meds was to treat seizures, not the discharges, but if discharges cause the seizures, it makes me more nervous that I'm having them. One of the comments says, the way the neurologist described it to us was that the discharge are like sparks and seizures. Seizures are the fires. The medicine helps them not turn into fires and should be reducing the number of sparks. We have to go through for another 24-hour EEG every 6 months to check the progress with the medication. Discharges.
Yeah, I think that one says it perfect. I mean, that's an example of, the sparks starting the fire, and you're definitely not considered under control until you can at least have a clean EEG. We all know how hard it is to even get a seizure to show up on an EEG. Never mind if they're having abnormal discharges on just a routine one, then they're probably having a lot more seizures than they realize.
Yeah, that's what I was thinking. Probably more than they're realizing.
I'm sorry. I was eating Cranberry Express. My bad. That a sentence probably having a lot more seizures than they realize, and they're still having like abnormal like discharges in their head, I guess. Before I was diagnosed, I was they would see like little weird spikes in the EEG, but not like a seizure. It wasn't a tonic-clonic or like it was the myoclonic ones, but it wasn't enough for them to be like, oh, it's fine. Like it's or no, it wasn't enough for them to be like it's not fine. Which is why they like shut me down for so long. Because they would see the rapid firing, but A, they couldn't properly read it, and B, it wasn't a full-blown tonic-clonic seizure. So those two things kind of play into perspective too. I forgot what the question was again.
No, you're describing what the question was asking about. Those epileptiform discharges are those random spikes you were talking about, but they
Yeah.
can consider them interictal, like in between seizures, or ictal during a seizure.
Mhm.
So it depends on how short they are, and they
Yeah.
can probably get away with saying you don't need treatment right now because your brain is just irritable, or come up with some goofy medical word that doesn't make any sense.
Yeah, especially if you're taking like your medication. Like if I was taking my Klonopin, it would help keep them under control, but I was still having them like a lot. Because I wasn't on like a really good dose. But it was kind of doing enough so that it wasn't showing me having the times where I'm at home where I'm like bedbound, the days where I'm bedbound, the weeks where I can't shower myself, my mom has to shower me. Like it doesn't show that on the EEG. So it's like it's kind of like your word against the EEG, and it's kind of a hard thing to fight in a way, I guess. Anyways.
So this is a post somebody just put up about an EEG. It sounds like more of a success. They're saying, today I had my first EEG. Towards the end, I was subjected to the flashing lights test. During this process, the left side of my face went heavy and numb, and the muscles felt like they were being pulled towards my ear. The corner of my mouth and brow bone began to spasm. Now, this didn't occur until the middle end of the test. Should I be concerned? This was my only symptom, or am I being dramatic? Go ahead, guys. You tell.
I did the light test. I didn't get that. I didn't get the sheep choking part. I didn't get anything. The light test didn't do anything to me. I actually left after that. I forgot what the general question was.
Come on, Mark. You know enough about EEGs. Can't you tell this guy what happened? Or girl, it's Patty something. Yes. Tell her what really happened on that EEG.
I mean, I don't know. I'm not photosensitive either. Um, my my focal seizures don't manifest as like facial twitching, muscle jerking. So yeah, I don't know what to say.
What stood out to me about this one is at the end, they're asking, should I be concerned? This was my only symptom. Am I just being dramatic? And what came to my
uh,
mind was that something happening like this in an EEG is not dramatic. That's far from normal. And
yeah,
that's definitely something that they should be able to work with you on.
that is incredibly fortunate to have caught that right then on an EEG. That is like, yeah, I don't know. I'm trying to think. I feel like there's some little colloquialism about, I don't know, timing and I don't know, like, I don't know. Striking gold doesn't seem quite appropriate, but that's sort of what you got there. You know, you're mining for data and they got the data. I would imagine from the EEG, they would be able to tell where it's happening. Um, but the facial twitching and stuff, it's I don't know where in the brain does the sort of muscular control come from? Is that because mine are frontal temporal lobe and I don't get jerking. Mine are more sensory and psychological. So, do any of you know about that?
Can you repeat that last part? The
Like they were talking about their face twitching, and I'm wondering if any of you know about where in the brain uh that sort of muscular control is located. Because I would imagine they would be able to tell somewhat where the seizures are coming from by that sort of symptomology, but having the EEG leads on at the same time, I don't know, that would be interesting to hear a follow-up from them if they have, you know,
yeah.
more information about where that was. Um,
I think I did used to have, I don't know because I couldn't see my own face, but like I know I felt, you know, tw- something going through my head and the jerks in my, like some sort of, you know, shock going through my head, limited to the head. Since I used to have really bad myoclonics, but like you said, it's also hard to define. I never know what kind of seizure it is, but I would be looking at my computer and focusing too hard and feel something really quick, but you know, it's been so long, it's difficult to remember. But yeah, I would definitely have um, small seizures limited to the face and brain and all of this area, you know. But as far as this person who's asking this question, uh, I can't remember the question. You
This
never
was my
am.
only symptom. Am I being dramatic? Should I be concerned?
Oh, no. It just sounds like you just nailed down a symptom. I think it's good to nail down symptoms, and yeah, I would be satisfied that you nailed down that. Yeah, to be good to be satisfied with what you found. That's a first step. Be satisfied with that.
Okay, so everybody has some insight on this one now. What changed your mind, finally convinced you to get on medication? This person says, "Hi everyone. I'm currently dating someone who was diagnosed with epilepsy about 2 years ago in his early 30s. Since then, he's had over 20 seizures, some quite serious, including one where he fell and hit his head. Despite this, he's still strongly against taking medication. He says he doesn't want to rely on a pill or deal with potential side effects like tiredness or hair loss, etc. We've only been dating for a couple of months, so I know I'm still new in his life, but I care about him deeply on a human level and I'm genuinely concerned. I get the sense that part of his resistance might be tied to denial, especially because his diagnosis came later in life. From what I've seen, his friends and family tend to avoid pressing him on it, and I understand why, but it worries me. At this point, although I don't want to lose him, I'd rather risk losing him than to see him get hurt one day and know that I could have potentially said or done something to prevent it. If you've been diagnosed later in life or if you initially resisted medication, I'd love to hear what helped shift your perspective. And for anyone who has had someone close try to talk to them about treatment, how would you have wanted them to approach it? I want to bring it up in a way that's respectful, not pushy, and doesn't feel like I'm trying to parent him. Thank you so much in advance for any advice and all love.
Dude, I remember reading this one literally this morning, and I don't know, it really stressed me out, because it's like I understand not wanting. Okay,
Sorry about that.
am I still muted?
No, you're
Nope,
good now.
you're good. Last thing we heard you say was that how stressful it is to even read that from their perspective. What were you saying after that?
Oh yeah, no, like I totally understand, feeling like already losing sense of independence, and I feel like all of us have that sense in one way, shape, or form. But just kind of being so anti-medication and the fact that it is like seriously uncontrolled. I mean, 20 seizures is pretty intense. Um, but there's unfortunately just a lot of people who have that mindset of I have this condition that likely can be treated with medication and it sucks and there's probably side effects, but I would rather have a seizure, than have some side effects from medication. So I don't know. It did honestly. And like going through the comments and stuff on there just kind of was a little stressy. And I feel for the girl. I understand where the guy's coming from, but I also think he's being like low key irresponsible if he includes other people because he's still driving, right? Isn't that what one of the comments in there said too, that the guy's still driving?
I can look for the driving part, but I was thinking selfish on his part.
Okay, I didn't want to like use the S word, but yeah, no, I'm definitely with you there, Kate.
Just leave that up to me.
I that's no, I wouldn't. Oh, so I'll get to you in a second there, Angel. I wouldn't say the guy's selfish. I understand he was just diagnosed, or did you say
2 years.
2 years? Okay, well that's still relatively early. I mean, yeah, I mean, I empathize a little with him because it's scary, and there's going to be some resistance at first. When I was first diagnosed, I was, resistant to taking medication, and he's dating this girl, and you know, yeah, I mean, the side effects are intimidating. So he's going to be resistant to these side effects. I can see that. I empathize with that. Um, but yes, in the end, he does have to take his medicine, despite the fears.
I just wanted to reiterate too at the beginning of the first paragraph here, she's saying, despite this, he's still strongly against taking medication. He says he doesn't want to rely on a pill to deal with the potential side effects. I'm getting the vibe here that he hasn't even seriously discussed this with a provider, definitely not
Well,
discussed his fears or concerns about the specific medication. He's just saying meds, nah. Oh,
maybe
sorry, Angel. I saw you got your hand up.
you got to break through those walls. That's okay. Sorry, you go on.
I was gonna say you got to put the ego aside, and for me, a big thing was, especially before uh insurance was mandatory, it was work. Like you needed to be medicated to stay off your seizures, and you didn't want to be sued instead. Um, but also, there's a lot more worse things that can happen when you go through your seizures, and you can break things like break your own body, teeth, you know, and that should be reason enough. But yeah.
Oh God, sorry, I'm on my phone and going back and forth unmuting is kind of awkward. No, but anyways, no, I'm totally here with you. Like he does kind of give the vibe that he's just against medication in general. And I remember one of the comments on there, someone was asking, like what's his thought process, if the roles were reversed and it was the OP who had a medical condition that could be, potentially controlled with medication, would he still tell her not to take it or would he push her to do it? So I think it really is, just kind of lack of education and not really like seeing it as a problem and not wanting to accept help. I think the guy's just kind of in denial too, is the vibe I'm getting at least.
I agree. What's up, Mark?
Yeah, I remember seeing this one on Reddit this morning, and um what was the title? Like, how did you get them to something or other, right? It was
What changed your mind / finally convinced you to get on
yeah, so I mean there's a couple things there that struck me. What changed your mind? It sounds, I mean, the changed your mind part sounds like she wants to go and actively fix the point of view of the other person, to get them to change their mind, realize what's good for them. And that's not something that would necessarily be healthy for a relationship to go out and start actively pushing on that. And I think didn't she say that it was a relatively new relationship too, like only a few months or something? Um, I don't know.
Yes, we've only been dating a couple of months. I mean, I see your point of that because she even makes a point too that she wants to come in not too pushy. So it sounds like this guy's already probably kind of resistant or maybe even heard this before. But just from the perspective, I mean, if she really cares about him deeply and he reciprocates those feelings, he would be able to listen to her reasoning. I, I would think.
yeah, yeah. But so to bring it around and to to answer that, to answer her more directly, what changed my mind personally was um having a tonic-clonic in front of my mother. Um, I had already known that I was having seizures at that point. Like I'd been logging them. I had a whole thing in my phone and a whole grading scale of how severe the vocals were. Um, and I'd had a couple like 10-15 minute long tonic-clonics in front of a roommate. So I knew that it was really something I should have been taking seriously, I guess, particularly now in retrospect. But I just kind of crossed my fingers and hoped that she wouldn't find out or something, that she wouldn't notice and it wouldn't happen in front of her, and that it just, I was in denial. I guess looking back, that's really the word that a psychiatrist would probably use for what I'm talking about right now. This is very therapeutic, I must say. But
Well, that's why I'm glad to find one of these posts that appeals more to the men than women in the group for today. But the first thing that came to mind about maybe showing him a video, showing some kind of irrefutable proof of how bad this is to truly help him understand why she's so passionate about him actually being more proactive about treatment. I don't know. What do you guys think? Did anybody really need convincing? What took you out of the denial state?
I think that back in my life, I wish someone had said something, you know, when I was um, not living such a healthy life. I would rather have someone intervene in my life than not say anything. I know it's the relationship is in its early steps. Sometimes we borderline, you know, this is a relationship advice could be on this. But yeah, you have to step in at a certain point, and people have to help. I would rather have help than no help at all. That's the bottom line. And uh, I know I know you might be afraid of damaging the relationship, but if you really care about someone, you have to help them.
And a reminder too, they said he's in his early 30s. So sounds like he's probably old enough to realize what's going on and how he definitely doesn't feel like himself per se.
Right. I know, but if he isn't seeing it, you need to intervene. And if he's in denial, people need to step in.
Yeah, for sure. And if she's posting this on Reddit, then this is probably a last resort as is. If she's already maybe attempted this once or twice and just quickly seen it was going to get nowhere. So, I don't know. I hope
Yeah,
this one works out.
if you care about the person enough, I mean, given their family isn't pressing it anymore, um, if she cares enough about about him, then like Kevin said, it would be better to risk losing the relationship, I think. I mean, not to completely lose the relationship rather than let him continue risking his own life, because who knows how long it would take for him to realize that. And
That's what she said. She would rather lose a relationship than actually lose him and realize
yeah,
or have that guilt of maybe having been able to prevent it.
but the loss of the relationship might be the kick big enough to get him to realize that this is something, it's not just family members going, getting a little nitpicky and stuff. This is people outside of the family too that are concerned and that are, you know, being lost, being pushed away over something like this. Uh, yeah, the more people who are saying this kind of stuff, giving him this kind of advice, the more likely he is to actually listen and change his mindset.
Yeah, that's a good point. The breakup could be the push he needs. What were you thinking, Liz?
Like being a little too much on kind of a straightforward, innocent post, but does it strike anyone else as kind of a red flag that the family doesn't seem very concerned about any of this?
I kind of got that same vibe. Yeah, I
Like,
understand.
kind of nobody really understands this diagnosis that this guy got, years ago, and nobody's really gone out of their way or really bothered to look into something. Because it almost reminds me of like other, like invisible disabilities, commonly kind of like diabetes. A lot of people don't take it super seriously because, oh, a lot of people have diabetes, and a lot of people live with diabetes. Same thing with epilepsy. A lot of people have epilepsy. It can't be that bad. And it's just kind of, I don't know, just people kind of brush it off and really don't bother to learn the severity of it.
Right. Yeah, like when I was a child, that's what it was. I didn't know, I was a child, so I was 16. I didn't know what my mom was talking to these doctors about. I was just told, you have epilepsy, you're gonna have seizures, and got some pills. And I went about my life like regular kid, just taking my pills on time and doing regular high school shit. And yeah, I wasn't taking care of my epilepsy at all. I wasn't paying attention, trying to find things that would make me stop having seizures. Um, they weren't bad, but they were bad. Like, yeah, they were sometimes 2 a month, and yeah, they sucked. After a while, getting my health in order, smaller by smaller increments than others. Um, I've gotten better with that, and now I'm down to 3 to 5 a year, and so far I'm on 2 this year, and the year's more than halfway over. So Hopefully, I can make it to a year. Then I can make it to 6 years like Kevin. Then 12 years like that other person. Gotta think big. Speak it into existence. I got one here though. But also the icebreaker for Kevin, you got here. And for the other person who was talking about why should we take the pills? Um, seizures aren't fun, so I take my pills because they're no fun at all. If I think I can prevent it by the smallest increment, I just take my pills because it's gonna stop a seizure, or at least try to. Angel, with the icebreaker, what was something you did to increase your quality of life once you had epilepsy?
No, I gotta think. What was
Liz, I
something I
don't think
need?
you got that either, did you?
No, I didn't.
No, I don't know if we
Something.
asked Liz the icebreaker. I can't remember. Oh yeah, we did. She said art and stuff like that. But go ahead, Angel. I'm sorry. Hey, Sia.
I see ya. Hope everything is still good.
Angel, what's the answer to your question?
Um, I guess I needed creativity stuff. You know, it was different ways I did things. Fresh air, like when I made that alligator in the sand.
Yeah.
You know, it's doing things that I needed to do to be creative. I think just throwing my mind out, you know, that increased my quality of life. And then my daughter definitely increased it.
I find interest in doing things that I'm not supposed to be doing because I have epilepsy. So when I do that and I do have epilepsy, it feels good, especially when I don't have a seizure doing it. I can say I did something that anyone else can
Like
do.
the weekend concert
Yeah, that
by yourself.
concept. The lights were gonna be unpredictable. But I had my bracelet and I told the girl next to me, and she had already heard of epilepsy. She said she knew about epilepsy. And from what she was explaining, you heard about epilepsy, you know nothing. So just told her, I'm not gonna have a seizure, is what I told her. My seizures aren't just because of these lights. Don't expect a seizure. Just tell her to calm down ahead of the time for the lights start and all that. Yeah, she was cool about it. Um, she was like 4 foot, 5 feet tall, so she could barely see. I recorded most of it. But anyhow, um, Sia, how you doing?
I'm doing all right. Not the greatest, but eh.
Gotcha. I understand where you're coming from. The icebreaker was, what did you do to increase your quality of life once you had epilepsy?
Um, Started doing things that I enjoyed more, like for a while when we were living in the city, we kind of stopped going out, stopped like exploring and stuff, going out to see nature. And then when um I started having the seizures, I just kind of started like, holding up at home even more. And it felt like it was impossible to go outside. And so once I started to find like any sort of control, we took that opportunity and we just like started going out like every single day. And we, of course, we wouldn't go out on my bad days, but on the days that I felt good enough to make it, we would go out for like super long drives out to the mountains, go fishing, go for hikes and walks and exploring and moving away from the city was like the best thing, I think, for our quality of life. I hate cities. I don't know why, I just do. So moving out to the country was the best choice. That is for sure number one.
How you gonna be from California and hate the cities? Come on. You
It's
don't come to
annoying.
Cali for
Traffic
the
sucks. I mean, I don't drive, but just sitting in traffic even as a passenger, it sucks.
oh man. Every time I go out there, I'm depressed. There's so much field and pasture and long streets with no traffic.
Yeah, it's nice when there's no traffic and you can go to the store and it's 2 minutes away and then go straight home. Or if you
But then
want to
it's
go see
hot.
nature,
It's
it's
so
like
hot out there.
it is hot, but
Yeah, I know.
it's like I don't know. You get more views out of it. The air is fresher, it's cleaner, and the sunsets are insane. And when there's a storm, it's not just a storm. It's not just a little bit of rain. It's lightning and thunder and snow. It's pretty. I love it.
Do you know?
Right,
That's
got
precious.
satellites for
Thank
it
you
out the way.
so much for coming today. And I'm glad to hear you're doing your healing. I know
Thank
it takes a
you.
couple weeks.
Yeah, it does.
Keppra and constipation. My sister has epilepsy and she has been taking Keppra. She has been complaining about bloating and constipation. Anyone else has such experiences? The neurologist said that's not a common side effect of Keppra. She's taken 500 milligrams. She has tried many medicine, and this seems to be the only one that helps to control her seizures. She still gets them, but not that often. Anyone have advice for Keppra and constipation? I have no similar experience to this person. Yeah.
And any medication websites don't suggest that that could be from the Keppra. It's the opposite. If there are stomach problems resulting from levetiracetam, it's usually vomiting, diarrhea, not constipation. So check out any other factors that could be causing it.
You heard me say levetiracetam earlier? I said it right, reading it for the first time. Yeah, I didn't
You
know
got
if
it
you
right
guys
with
podcast.
practice. That's right.
Please take your medication as prescribed or whatever works for you. We're not doctors.